Hello everyone, Dr. Stillman here, and today I'm going to be telling you everything that I think you need to know about magnesium. This is not medical advice, etc., etc. Make sure you follow my other social media channels like Substack, Telegram, Instagram, Facebook. I'm putting out a lot of YouTube videos that are great, by the way, if you're not watching this on YouTube already. Let's dive into magnesium. So first of all, what is magnesium? Magnesium is a vital mineral to the body. It is on the periodic table of elements. For those of you who don't know what a mineral is, it is a positively charged mineral, and it plays a really important role in a lot of different physiological processes, which is why the first paper we're opening up with is aptly titled Magnesium's Role in Health and Longevity. And I tried to highlight part of this, but it's so impactful, every sentence in this abstract, that we're just going to go through it line by line. So reduced magnesium intake is a frequent cause of magnesium deficit with age. The other piece of this is also stress, and stressors in the environment will reduce, or rather cause, magnesium losses, okay? Decreased intestinal magnesium absorption and an increased magnesium loss may also contribute, as well as the use of medications. Okay, medications cause a lot of magnesium loss. I always am on the lookout for this in patients, and it may also prevent you from absorbing it, okay? Magnesium requirements may be higher with aging. More on that later. Alterations of magnesium metabolism with age, cellular magnesium transport systems, and problems with measurement methods are discussed in this paper. We're going to get into all of that as we go. Magnesium contained in water is more bioavailable than magnesium in food, okay? And we're going to talk a little bit about that when we actually look at different foods, okay? It's an alternative to magnesium supplementation. It's never going to get you to where magnesium-rich foods and supplements can, though. Mild to moderate magnesium deficits are generally asymptomatic. If you know what to look for, very few patients are truly without symptoms of this. Clinical signs are usually absent or non-specific. Non-specific is really important, and this is why a lot of you guys don't end up with a diagnosis of low magnesium from a practitioner, even when you go see someone who's well-educated and they're in functional medicine or integrative medicine or whatever. Docs are just not being prompted by their thinking, their training, and then by their patients or their colleagues to measure levels of magnesium and to infer that even if we can't say, okay, the magnesium is definitely the cause of your disease, at least it's contributing or might be contributing. And if we correct it, maybe we'll see a clinical benefit, okay? Hyper-emotionality, tremor, asthenia, sleep disorders, amnestic and cognitive disturbances are frequent in older adults. They're also perfectly common in younger people. They're getting more common in younger people because of the influence of technology, and our crazy lifestyles are creating lots and lots of different, I would say they're contributing to magnesium deficiency, although I don't have all the data in the world I would like to prove that, okay? These symptoms may just be called normal aging. That is nonsense, okay? You are not doomed just turning into some miserable, disease-riddled old person. You can age gracefully. It's possible. Magnesium is essential to that. Chronic magnesium deficiency results in oxidative stress and chronic low-grade inflammation, which is a fancy way of saying chronic magnesium deficiency slowly chews through your vitality and leaves you feeling sick, old, and wasted. And that means that repleting it can really make you feel a lot better. Magnesium deficit related conditions may involve different tissues and organs, including hypertension and cardiovascular disease, #1 killer of Americans, diabetes and metabolic syndrome, which contribute to and cause hypertension and cardiovascular disease, asthma and airway constrictive syndromes, depression and psych disorders. You get the idea. Pretty much all the diseases that all of you want to avoid are linked to low magnesium levels. Okay, and that makes maintaining an optimal magnesium balance vital to life. And when I say optimal, I want to be really clear. I like the fact that they use this word. It's more than just dump magnesium into the system. Many people will tell you, you are sick, therefore you need magnesium. I am not going to tell you that, because I see normal magnesium levels on a regular basis. No, I'm not just talking about the serum level. I am talking about other body tissues, the hair, the red blood cells. And one of the things that I think is missed is that magnesium, potassium, calcium, vitamins, other minerals, amino acids all play together. And so imbalances in one can lead to imbalances in another. And so just looking at this as, oh, we need to give everyone magnesium is very simplistic. I do not approach cases that way. If this video has been helpful to you, make sure that you check out my link tree below to find out how you can keep in touch with me best. And if you would like to become a patient at my practice, please apply to work with me at stillmanmd.com. Thank you again for watching. Have a great day.